Good afternoon, everybody. Happy Monday. It's the 25th of January. I'm going to give hopefully a good news for a change COVID update. I think there's some good news that came out today and over the last couple days. You know, we're not through this yet, but there might be some light at the end of the tunnel coming up. For those of you new, my name is Jeffrey Galvin. I'm a board certified emergency medicine doctor. Also run a functional medicine, precision medicine clinic in Charlotte as well, where we do lots of everything from weight loss and hormone therapy to advanced executive health assessments and other kinds of things. I've been doing updates about COVID because I still work in the emergency department since this began, and so this is kind of ongoing. And we also do some wellness videos, which we have a new series starting later in the week. So anyway, on to COVID. As usual, we talk about cases, and cases have dropped a little bit. 132,000 new cases yesterday. We're up to 420,000 deaths, unfortunately. But the positivity rate in the country has dropped to about 9%, which is really good. Now remember, data that you get on Monday and Tuesday is always looks low because we just don't do as much testing and over the weekend. So really, if you really want to know what's probably going on for real, you really need to look at the data like probably Wednesday, Thursday, and Friday. But that being said, things look like they're getting better from that front. Hospital admissions are starting to trend down. In my state of North Carolina, we had a peak of about 3,900 admissions. I think we're down to 3,300. Emergency departments are still really full. The hospitals are still really full, but maybe a little bit of breathing room. Vaccination front, 66 million people have been vaccinated worldwide. 22.4 million here in the US. And, I think much to the anti-vaxxers' chagrin, really minimal issues, very, very minimal issues, some allergic reactions, but really, that's a giant number of people that have been immunized with almost no problems at all. I've had both mine, no issues, felt a little flu-like after the second one for about 18 hours, but I survived. So on to the good news. First up, on that vaccination sort of front, Israel announced some very interesting information. Now, Israel, has you got to understand, is doing an incredible job with their vaccination program. I'm going to show you, look behind here. This is doses administered per 100 people. So basically, what percentage of the population? This is Israel. They've immunized 41, almost 42% of their population so far. Next up was United Arab Emirates. United Kingdom was 10%. We're lagging at about 6% in the US. So Israel has done this huge job, and they've basically treated it as a giant clinical trial. So what they did was they gave the first 600,000 people, they started comparing it to 600,000 people that didn't get it. And what did they find? Well, the Israeli government numbers showed that 3 weeks after receiving the first vaccination, they're using Pfizer, it's 2 doses, but after the first dose, what they found was 3 weeks after that, admissions and infections dropped by 50% in the group that got vaccinated versus the group that didn't get vaccinated. And that was from the Israeli government. But there are actually, I guess, 2 major health systems in Israel, one called Maccabi and one called Clalit. And Maccabi showed a 60% reduction in that same 3-week time, so 3 weeks after the first admission. And Clalit showed a smaller 33% reduction, although apparently Maccabi kind of gave immunizations to everybody, and if they didn't have enough people signed up, they would give it to whoever was around. So they had a younger population, and that may have skewed the numbers. But regardless, very, very encouraging results, and they're continuing to track it. And again, very few problems in Israel, and now 40% of the population has been immunized. The next thing was a study that came out of Canada today. It's pre-release, has not been published yet, but the investigators thought the results were surprising and kind of stunning enough that they released it. And this involves a drug called colchicine, which has been used for hundreds of years for gout. It's inexpensive. We've used it forever, and it's an immune modulator. And what we think the reason they did the study was they thought, well, maybe that reduction in inflammation that colchicine causes might stave off the cytokine storm that results in people getting really, really sick, getting intubated, and ultimately dying. And they did it right. They did the gold standard. They did a randomized, placebo-controlled, double-blind study, meaning that the The investigators didn't know who got the drug, who didn't. It was randomized who got it. And one group half the people got the drug, and half the people got a placebo. And then after a certain period of time, they looked at who, and these were people, excuse me, a little exercise-induced asthma from my workout the other day. These are people that got COVID, and what they found was very amazing. A 25% reduction in hospitalizations if the treatment was started early, a 50% reduction in intubations, and a 44% reduction in deaths. Now, that's pretty incredible, and it's a cheap drug, but we like cheap drugs, that's been used forever. And what the thought is, it prevents this major cytokine storm. Now, again, it hasn't been peer reviewed yet, meaning it hasn't been published, but the data is certainly impressive, and that's a medicine that anybody can prescribe. The last thing I'm going to talk about is what's called Bamlanivimab. I think that I pronounced that right. That's a monoclonal antibody. There's another combination of monoclonal antibodies as well that President Trump received a therapy like that when he got sick with COVID. And on the a week ago, we suddenly got this available to use in the emergency department. And like many times in the emergency department, it's things are catch-22. You get this therapy and you realize that you can't use it. So ideally, it's treatment for people that have mild to moderate symptoms of COVID that are high risk. And high risk is defined as someone who's got a BMI over 35, they've got diabetes, chronic kidney disease, they're immunosuppressed some way, or they're over 65 or over 55 with hypertension, heart disease, or COPD, or age 12 to 17-year-olds that are obese, have sickle cell disease, have congenital heart disease, some kind of neurodegenerative disorder like an implanted G-tube, trach, severe asthma, things like that. It's not for people who don't have any symptoms. It's not for hospitalized people, and it's not for anybody that needs oxygen because of their COVID. So it's something that you could conceivably give in the emergency department. The problem is that it requires an hour infusion and an hour of observation. And in an emergency department setting where we are absolutely, we've got people in hallways and 12-hour waits, that doesn't really work very well. So it's very even though we have it available in the emergency department, it's very difficult right now for us to give it in the emergency department. But Novant and Atrium, I believe the two major systems here, have set up infusion centers. So it needs to be coordinated through a primary care doctor. So it's not ideal. Ideally, you'd like to be able to diagnose these people, identify them with risks, and give it in the emergency department. But there's just no way I can, unless things start calming down significantly, take up a bed that, for 2 additional hours. They're already probably taking the bed for 2 hours as they're getting evaluated. To take another 2 hours or more to give the infusion, to take nurses' time to do that, probably not the greatest thing to be used in the emergency department, but we are setting up the ability to do it in an infusion center. So that's, good and bad. But hopefully, generally positive news today, right? Now, I hate to, don't hate to do this to you, but I do want to give a little piece of personal advice to all of you. I've been in contact with my friends in England who are emergency physicians there. The new variant there is excessively contagious. And this would be my personal recommendation because we know it's circulating in the US and we may well run into another big surge related to this new variant. So this is what I would like you guys to do. For the next couple months, throw away your cloth masks. Get an N95 mask. They're available. There's no shortages anymore. You can buy them. It's going to provide a lot more protection. And, according to the folks that are dealing with this in England, this new variant is so contagious that cloth masks don't provide near the protection in N95. So if you got a chance, if you go into a store, if you have one, wear an N95 as opposed to cloth. That's not coming from any official edict from anyone. That's my personal advice to you. It's what I'm telling my friends and family to do until they get immunized, is to wear an N95 for the next 2 months, 3 months, until we kind of get through this big surge and we get enough people immunized. Please, if you like these videos, follow us on Facebook and on YouTube. Subscribe to our channel. Hit the little bell so you get notified when I post. We've got some wellness starting up this week. We're going to be talking about weight loss. February is Heart Month, so we're going to do a little digression into heart health probably beginning of next week, and then we're going to kind of continue with weight loss and a whole other bunch of wellness topics going forward, but I'll still be doing the updates like this as well. Have a great day. See you soon.